Welcome to the Deep Dive. Today we're getting into something really fundamental for healthcare leaders. How do hospitals actually talk to their boards, their governing bodies, about quality improvement? It sounds simple, but it's crucial.
It really is. We're looking at, what gets shared, why it matters so much for patient care and, well, for the whole organization.
And we're pulling from some heavy hitters here, right?
Mm-hmm.
Like JCI Joint Commission International.
Yep, the global standard, folks. And NABH in India, the National Accreditation Board for Hospitals and Healthcare Providers. Plus, insights from places like Supreme Medic Consultancy and ISQA, the International Society for Quality in Healthcare, and just, practical advice on making these reports work.
So our goal for you today is pretty straightforward.
Yeah.
Get a really clear handle on how leadership stays plugged into improving care without getting bogged down in, endless details or jargon. Sound good?
Sounds great. Let's dive in.
Okay, so first things first. Why? Why is this reporting to the board just so absolutely essential?
Well, fundamentally, it's about connection. It connects all that hard work happening on the ground, improving care, fixing processes directly to the hospital's big picture goals. The board's looking at the long game, right? Sustainability, reputation.
Strategic direction.
Exactly. So these reports show them how quality improvement isn't just some side project. It actually drives things like better patient safety, lower costs, happier patients, things the board really cares about.
Okay, so it's aligning the day-to-day with the long-term vision. That makes a lot of sense. What else?
Resources. That's a big one.
Money and people.
Yep. If you want funding, if you need staff for these QI initiatives, you've got to make the case. Clear, impactful reports that show the value, the return on investment, they're your best argument. It shows the board this isn't just an expense, it's an investment.
Right. Showing that putting resources into quality actually pays off, maybe not just in dollars, but in outcomes, in fewer problems down the line.
Precisely. And that leads straight into accountability. Well, when the board gets regular updates, there's nowhere to hide, really. They see the progress.
Or the lack of progress.
Or the lack of progress, yeah. It fosters this culture where everyone knows quality is being watched at the highest level. It builds transparency.
And allows the board to actually hold the teams accountable for hitting those quality goals.
Exactly. It keeps the pressure on, in a good way.
Mm-hmm.
And there's also guidance.
Guidance from the board back to the teams.
Yeah. Things get complicated, right? Challenges pop up. Having the board informed means they can offer strategic advice, maybe unblock obstacles, help keep things aligned with the big picture using their, broader perspective.
So it's a two-way street, really. Information flows up, guidance flows down.
You got it. It prevents quality from becoming this isolated thing.
Okay, that definitely covers the why. So let's get into the what. What absolutely needs to be in these reports? What are the core components?
Well, like we touched on, you almost always start with an executive summary.
The quick version.
The quick version, yeah. Think of it as the trailer for the movie. Key findings, major risks, what's being done right now, how it links to the mission, regulatory stuff.
All boiled down.
All boiled down. Because board members are busy. They need the bottom line up front.
Makes sense. So after the summary, where do we go? Lots of data, I assume.
Oh, yeah. Usually a quality performance dashboard. This is where numbers come to life.
The graphs and charts.
Definitely. Showing those key performance indicators, KPIs, monthly, quarterly, clinical stuff, operations, patient safety.
What kind of things are key on that dashboard?
Trends are huge. Are we getting better or worse on infection rates? What about patient falls? You need benchmarks, too. How do we compare to others? And targets, are we hitting our goals?
Visuals are key here, I guess. Heat maps, graphs.
Absolutely. Makes complex data much easier to digest quickly. You might see things like surgical site infection rates, medication error rates, patient satisfaction scores are always big, hand hygiene compliance.
Things that really reflect safety and experience.
Exactly, and often leading indicators too, like staff training completion, things that might predict future performance.
Got it. So beyond the overall dashboard, what about specific projects, the actual improvement work?
Right. For any significant quality improvement project, or QIP, you need a little summary.
What, a mini report for each one?
Sort of. Just the essentials. The project title, what it aimed to achieve the objective. Then, the problem it was tackling, what interventions were actually done, and crucially, the results.
Before and after data.
Ideally, yes.
Yeah.
show the impact clearly, and really important, a sustainability plan. How do we make sure these gains stick?
Right, not just a one-off fix.
Right.
What about the less positive side? Incidents, safety events,
Yeah, that needs its own section. You have to report on adverse events, near misses.
those close calls.
Exactly. And sentinel events, the really serious stuff, but it's not just listing them.
It's about the learning, right?
Absolutely. Summarize the root cause analysis findings, the RCA. What went wrong systemically? Then, what corrective actions were taken? What did we learn? Did policies change? The focus has to be on preventing it from happening again.
Learning and improving.
Yeah.
Okay. What about, like, external stamps of approval, accreditation?
Crucial. The board needs to know the status of things like NABH or JCI audits.
These big accrediting bodies.
Right. What did the external surveys find? What about our internal audits? Are there any nonconformities? And if so, what's the plan to fix them? How's progress?
Keeping the house in order, basically.
Pretty much. And just to remind folks, JCI is that global benchmark, really rigorous standards recognized everywhere.
And NVH is the key player specifically within India's healthcare system.
Correct. Part of the Quality Council of India setting those national benchmarks.
Okay. So we've covered data, projects, incidents, audits. What about people, patients and staff?
Can't forget them. Their feedback is gold. So trends in patient satisfaction are key. How are complaints handled? What are patients telling us?
And staff, too.
Definitely. Staff feedback on safety, culture, workload, burnout. That gives you huge insights into the work environment, which directly impacts care.
That makes sense.
Yeah.
Happy, supported staff deliver better care.
It's a known link. And related to staff, you also need to talk about training.
Capacity building, right?
Exactly. What training happened? Who participated? How is it actually improving skills, compliance, certifications? It shows investment in your people.
Okay. Almost there. Anything else essential? Risk seems like a big one for boards.
Yep. A dedicated risk management section. What new risks are emerging? Clinical risks, operational, even legal ones.
And not just identifying them.
No, you need proposed mitigation strategies. What
Right.
are we going to do about them? And sometimes you need specific board action or decisions to tackle a risk effectively.
Okay. And finally, looking forward.
Gotta have that. What are the quality goals for the next quarter, the next year? And critically, what support do the quality teams need from the board to make it happen? Resources, policy changes, budget approvals. Be specific.
Wow. Okay. That's a lot to pack in. So having all that information is one thing, but presenting it effectively to the board, that's another challenge.
Absolutely. Presentation is key. First rule. Keep it strategic.
Don't get lost in the weeds.
Exactly. Avoid super technical jargon. Remember, your audience, they might not all be clinicians. Tailor the language. Think problem, solution, impact.
Make it easy to understand the bottom line for each item.
Precisely. And visuals. We mentioned dashboards.
Yeah, graphs, trends.
They make data so much clearer, more memorable than just pages of text or numbers. A good chart tells a story.
What about the financial angle? Does that resonate with boards?
Oh, definitely. Showing the return on investment, the ROI of quality work, that gets attention.
How do you do that?
Well, you can show cost savings from fewer readmissions, maybe lower infection treatment costs, or the upside, better patient loyalty, enhanced reputation. Frame quality as good business.
Makes sense. And using real stories, does that help?
Hugely. Anonymous case studies, maybe a brief story about an incident and the positive changes that came from it. That makes the data real.
Humanizes it.
Exactly. Share success stories, too. Positive patient outcomes really highlight the why behind all this effort.
Good point. And don't forget the compliance piece.
Never forget compliance. Show how these QI efforts help meet regulations, maintain accreditation, protect the hospital's reputation. That speaks directly to the board's oversight role.
Okay. So strategic, visual, show the ROI, tell stories, link to compliance. Anything else for an effective presentation?
Make it action-oriented. Don't just dump information.
Tell them what you need.
Yes. Clearly state the next steps, what decisions are needed from them, what resources. Guide them towards supporting the next phase of improvement.
Be clear about the ask. Got it. So we mentioned JCI and NABH earlier. Can we just briefly clarify their roles in this whole quality picture?
Sure. Think of JCI as setting the global gold standard. They develop these really tough international standards for quality and safety that hospitals worldwide measure themselves against. Over 1,000 programs in 70-plus countries use them.
And NABH.
NABH is focused specifically on India. It's part of the Quality Council of India, and it sets the benchmarks and runs the accreditation programs for Indian healthcare organizations, considering the local context, resources.
Tailored standards.
Right. While JCI might be the global ideal, NABH provides that practical, achievable framework within India.
And then you have organizations like Supremedic.
Yeah, they're consultancies. They provide the hands-on help, like helping a hospital actually implement a quality system, get ready for an NABH audit, navigate the paperwork, practical support.
Boots on the ground.
Exactly. And finally, ISQA, the International Society for Quality in Healthcare.
What's their role?
They're like the global connector, a nonprofit focused on spreading quality improvement knowledge worldwide. Through education, sharing best practices, connecting professionals, they foster that global community dedicated to better care.
So it's this whole ecosystem, global standards, national standards, practical help, knowledge sharing, all pushing towards better quality.
That's a good way to put it.
Now, one last practical thing we saw was this idea of a one-page scorecard. What's the value there?
Yeah. That's basically the ultimate executive summary, but just for key data points.
Super concise.
Super concise. You list maybe 4 or 5 critical indicators: surgical site infections, patient satisfaction, whatever's most crucial. Then you show the target, the actual number, the trend, up, down, flat, and maybe a simple status like red, yellow, green.
So the board can see at a single glance where the big wins or big worries are.
Exactly. It's that immediate high-level check. Doesn't replace the full report, but gives that instant snapshot. Very useful for busy board members.
Okay, that makes sense. So if we were to boil this entire conversation down, what's the absolute core takeaway for anyone listening, especially if they're involved in healthcare leadership?
I think the main thing is this reporting, it's not just ticking a box. It's not just paperwork. It is the vital link, the communication channel that keeps leadership connected, engaged, and supportive. It fuels that constant drive for safer, better care. It's absolutely fundamental.
A vital communication link. I like that. And maybe a final thought for you, our listener.
Yeah.
Think about these ideas. Clear communication, using data smartly, accountability, continuous improvement. We talked about them in healthcare quality, but how might those principles apply in your own work or other areas you care about? Where else is that kind of transparency key to making real progress? Something to think about. Thanks for joining us for this deep dive.